Hi friends, this is nursebazaar.com. Now we are discussing anatomy and physiology of heart. Today's class is cardiac output basics. What is cardiac output? The definition of cardiac output is it is the volume of blood pumped out of the right or left ventricle per minute, which means per minute a volume of blood is pumped out of your right or left ventricle. From your right or left ventricle, a volume of blood is pumped out. The amount is known as cardiac output. There is a formula for calculating cardiac output, that is stroke volume, that is SV, into heart rate, HR. So cardiac output equal to stroke volume and heart rate. We'll see what is stroke volume. Stroke volume is the volume of blood ejected by each ventricle during a single contraction. Don't get confused. Stroke volume is volume ejected by each ventricle during a single contraction. Before, when I told about cardiac output, I told per minute. Here, single contraction, when there will be a single contraction of a ventricle, a amount of blood is ejected, that is stroke volume. Next, heart rate, the number of heartbeats per minute, that is heart rate. So in one contraction there will be a volume of blood is ejected from ventricle, so we will multiply it with number of heart rates. Normal stroke volume is 70 ml and normal heart rate is 72 per minute. So when you calculate 70 into 72, almost you can get 5 liter. So the normal cardiac output normally says it is approximately 3 to 5 liter per minute. Our cardiac output varies widely with the health of the individual and state of the activity. Suppose if you are resting, your cardiac output may be less. If you are doing any exercise, the cardiac output will be more. You can see the cardiac output of an athlete will be more. So I told you that cardiac output is mainly based on our stroke volume and heart rate. So when the stroke volume and heart rate change, it will automatically change your cardiac output. We'll see what is stroke volume. I mean the things which regulate your stroke volume. The first one is preload. Preload is the degree to which cardiac muscle cells are stretched by the blood entering the heart chambers. Preload means when blood enters into your heart chamber, the degree to which these muscles can be stretched. Here the word stretch. How much your heart muscle can be stretched. If your heart muscle can stretch more blood will enter into your chamber. That is preload. Second is contractility. Contractility means the amount or the degree to which cardiac muscle cells can contract. See the difference, stretch and contract. Contract means the word contract and the stretch, both words are having different meaning. Okay, contractility means how much the cells can contract. You know that in some situations, like when we give some certain hormones or certain medicines, the heart muscles contractility is increasing. So for increasing cardiac output, doctors are giving positive ionotropic, which means some medicines or something they are giving to increase the contractility of the heart. Automatically it will increase the cardiac output. The third one is afterload. Afterload is the pressure generated by the ventricles to force the semilunar valves open. So afterload means the amount of pressure your ventricles can generate to open the semilunar valve. What are the semilunar valve? Pulmonic valve and aortic valve. So if more pressure, if your heart chamber ventricle can give more pressure, then it will increase the afterload. It will increase the afterload. So afterload means the amount of pressure given by your ventricles to open semilunar valve. If you are getting confused with preload, contractility, afterload, forget about it. The main thing is in the cardiac output, it is stroke volume and heart rate. I told stroke volume is the amount of volume ejected by your ventricle per one contraction, but cardiac output is amount of blood ejected per minute. Okay, so the formula for cardiac output is stroke volume into cardiac output. The second thing I discussed about the stroke volume, I mean the factors affecting stroke volume. That is, one is preload. Preload means how much your heart ventricles can stretch. Second one is contractility. Contractility means how much your heart ventricles or heart chambers can contract. The third one is afterload. It is how much pressure your ventricles can generate to open semilunar valves. When I say heart ventricles, I am not mentioning atrium. It doesn't mean that atrium is not working. It is there, but we give more preference to ventricles. That because the cardiac output is mainly when we determine, mainly we see the functions of ventricles. That is why I tell ventricles. So this is about cardiac output.